name is Michele Rigsby. I am a registered nurse. I currently have my associate degree in nursing. I'm enrolled in the RN to BSN baccalaureate program at Lamar University. I have less than 2 years of emergency medicine experience. I began as a nurse extern. I was a nurse extern for approximately 6 months. I then accepted a job as an LVN in the emergency department. I was an LVN for approximately 1 year. I then continued to accept a job as a registered nurse in the emergency department. I kept this job for approximately 3 months before moving to neonatal ICU. I have been working in neonatal ICU for approximately 3 months now. I am a dog mom of 1. My hobbies include traveling and learning new things. For the student learning outcome of humanity and society construct, I utilize nursing 4340 and 4241, care of communities. These were evidenced by Objective 6, which I formulated priority areas for research and evidence-based practice in the care of communities and global population. Student learning outcomes were met by lectures, studying and applying course materials, testing, participating in student clinicals and practicum, multiple assignments met these objectives. Student learning outcomes were met by utilizing safe and effective patient-centered holistic care to the variety of populations and utilizing evidence-based practice and application of theories from this course. Student learning outcomes were met with Community Outreach Education Project, the Julie Rogers Gift of Life Teaching Project, Community Windshield Survey, and the Port Arthur Health Department and Agency Analysis. Outcomes were met 95%. For the student learning outcome, Lifespan Health Continuum Construct, I met this construct with Nursing 3440, care of the older adult. This was evidenced by Objective 2 and Objective 12, by describing the patient's holistic, multidimensional health needs related to health promotion and disease prevention, and discussing palliative and end-of-life care for the older adult. Student learning outcomes were met by caring for patients with complex multiple health states, providing knowledge to patients to prevent diseases, maintaining health, and restoring wellness in patients. These were accomplished through didactic, practicum, course materials, and assignments that were required for the course. Student learning outcomes were met with the end-of-life research paper and practicum journals and clinical experiences. Outcomes were met 98%. The student learning outcome of Lifespan Health Continuum Construct was met with Nursing 4620, care of clients with compromised multiple health states. This was evidenced by evaluation of patient-centered healthcare across the lifespan based on complex health needs of patients in compromised multiple health states. I determined health needs of patients in compromised multiple health states and developed a nursing care plan to address patient needs and learning outcomes. Student learning outcomes also were met by required course reading and outside materials. Student learning outcomes were met with practicum reflections 1 through 4 and with discussion boards 1 through 4. Outcomes were met 99%. Student learning outcome of evidence-based practice and clinical reasoning construct was met by Nursing 4390, nursing inquiry and evidence-based practice. This was evidenced by utilization of clinical reasoning, critical thinking, research, evidence-based practice, and judgment in nursing practice and care of patients. Student learning outcomes were met by research, assignments, didactic, and were utilized in care of patients during practicum. Student learning outcomes were met with quantitative research paper and practicum journals. Objectives were met 95%. The student learning outcome of patient and client-centered care was met by Nursing 4390, nursing inquiry and evidence-based practice. This was evidenced by utilizing the link between theory and research as a foundation for evidence-based nursing practice when providing safe and effective patient-centered care. Student learning outcomes were also met by collaborating with the inter- and intraprofessional healthcare team and sharing research findings to utilize the best practice in patient care. Student learning outcomes were met with quantitative research article and with the practicum, care, and reports. Objectives were met 94%. The student learning outcome of professional roles construct was met by nursing 4350, leadership and management in the healthcare system. This was evidenced by objectives 5 and 6, which differentiated and utilized multiple roles of healthcare team and apply the knowledge of legal, ethical, and regulatory parameters within specific healthcare environments. Student learning outcomes were met by practicum and respective practicum assignments following utilization of didactic, course materials, and research. Student learning outcomes were met with practicum-specific management roles and follow-up journals and assignments. They were also met with practicum-focused activities. Learning outcomes were met 96%. Student learning outcome of professional roles construct was met with nursing 4241, care of communities. This was evidenced by utilizing and demonstrating effective communication, integrity, active inquiry, and service to the community during assigned student practicums. Student learning outcomes were demonstrated by respective practicum journals and assignments, required course materials and readings, and research. Student learning outcomes were met with CBSL volunteer hours and with the quantitative research article. Objectives were met 98%. My 5-year career plan starts with obtaining my degree in Bachelor of Science with a nursing minor in psychology. I plan to continue to work in the NICU for full time for approximately 1 year, and after that, apply for an emergency medicine position, PRN. I plan to pursue travel nursing in approximately 18 months to 2 years. My plan is to continue to grow and develop new skills and research in a variety of healthcare settings. I also plan to receive accreditation as a RNC and CEN within 2 years.